I will give two talks during this meeting. One talk is about the reshaping of the neck in the younger patient. Often this population of patients come to our office asking for a rejuvenation or beautification of the neck. And usually we can use injectable like fillers or Botox for the upper part of the face and for the cheek. But in the neck, the only tool that we have is surgery. And I present during my talk different clinical situations which require a surgical approach, and such as liposuction, neck liposuction, or submental neck lift. In submental neck lift, the shape of the neck is recreated with a plasty of the platysma muscle and selected removal of fat in the superficial and in the deep compartment. The second talk will be about secondary abdominoplasty. This is a very difficult operation because there is not enough skin after the first operation, because the scars are usually very long and very high, and also because often there is a problem of shape or of position of the navel. I see in general a further growth of aesthetic surgery in all the world. Even in the so-called emergent countries, as soon as the economical condition improve, there is an increase of the request for surgical or medical procedure in the aesthetic field. I think that aesthetic surgery in the future should be multicultural, because we have a lot of patients coming from abroad, and they have specific requests due to ethnic condition. And I think that the modern plastic surgeon in the future should be able to address also this kind of particular request. What is very important for me is that this increased request of aesthetic surgery will be accompanied by a proper training of the physician that take care of this specialty. So I think that the role of ISAPS or national society like the Romanian one is to provide a proper training for the new generation in the aesthetic surgery. I don't like patients that want to stand an aesthetic results. In my practice, my ideal goal is a natural result. I would like it at the end of the procedure, after that the healing time has passed, anybody notice that the patient has been operated. Of course, all the friends and the parents of the patient notice the difference in the shape of the nose or in the volume of the breast. But for the person that do not know before my patient, it is very important that the result of my operation will appear natural. I like the role of social media in our practice. As any modern plastic surgeon, I use the social media also to promote my practice. But I don't want that this social media put too much pressure on the patient to be operated. Information is very important. This is one of the main roles of the social media, and I think that information should be always ethical and realistic, and I don't think that it is a good idea to put too much pressure on the patient to be operated, because at the end the risk is to have an unsatisfied patient. As I mentioned before, I think that education is one of the most important targets for any international and national society. I appreciate very much the level of the lecture of this meeting, And I think that proper training is mandatory for any medical specialty, but it became even more important for us as plastic surgeons because we operate healthy patients.